welcome. We're just going to gather for a couple of minutes for more folks to join, and then we'll get started. All right. Well, let's go ahead and get started. Welcome to Community Space. My name is Priya Banati, and I'm an Associate Director here at the Q team. I'm joined today with my colleague, Sean Henry. This workshop's main conversation will be led by fellow Q members, Sophie, Segal, Jonathan, and the rest of you, for this is your community space. For those of you who are joining this series for the first time, welcome. Community Space is a bi-monthly opportunity for Q members to connect, learn, and collaborate together. Each workshop begins with you and the learning you bring to share with your fellow members. We recognize that improvement work is adapting to support the recovery from COVID. This is a safe space for all of us to connect and learn from each other. Each of you play an important role in helping each other understand the needs for the recovery of staff and services, and by sharing ways that this is being considered in your improvement work. By using creative and collaborative methods, we hope to explore the future of improvement together. We've kicked off this bi-monthly series in July, and we started with a conversation about how your improvement work is adapting to support the recovery of staff and services. We recognize that improvement has a key role to play. In this community and through this series, we can mobilize our experiences and support each other in exploring this future of improvement together. We know that in a community of 4,000 members, a large majority are not able to make it to a single workshop. This is why we followed the first workshop with a creative practice, that of sketchnoting with Tanmay Bora, to move this conversation that we'd had in the first workshop forward into and across our community. Today, we're going to take one step further along this journey and focus our attention on the pressures of backlog and how improvement work can support service recovery. Before we begin, it is important for me to reiterate that this is your community space and we will be led by you. From our first session, we learned that less is more. This means that we will not force a fast pace nor pack these workshops with a lot of content. Instead, we'll use fewer slides and support you to share your work experiences with your peers in ways that are engaging and that support conversations. We are thrilled to have more Q members step up to drive and lead these discussions in this space. And we hope that these provide plenty of opportunities for you to connect with one another. This also means that the Q team will step back and enable this space to be truly yours, to shape in ways that bring value to your improvement work. Each workshop will end with a short set of evaluation questions where we invite you to share with us what's worked well and what would make this space even better for you. Please be sure to complete this for those of you who have a challenge or opportunity you'd like to bring to this space. This is where you can share this so that our team can reach out to you when planning for the next workshop. Okay, let's go ahead and pause. Please go ahead and turn your cameras off. If it helps, close your eyes. Think about your improvement work over the past 2 months, the people you've met, those you've interacted with. Perhaps there's something that you've found yourself being more curious about, or something that's refused to go away. Notice how your work might be changing, adapting, even struggling with new challenges and opportunities. Sit with these thoughts for a minute. Let them come and go until you find yourself drawn to 1 or 2 thoughts that perhaps want to stay with you today during this session. Now, open your eyes and take a moment to write those thoughts down on a piece of paper. We are going to invite you into a breakout room with 2 other fellow members. Please introduce yourselves to one another. Consider sharing your thoughts about how your improvement work with each other, and listen to what your fellow members share with you in return. For those of you who might have attended a recent sketchnoting workshop and have brought a challenge with you to this workshop, please share that with your group. And then ask each other if there's anything you'd like to work on in this space with others. Be as specific as you like. We'll see you back here in the main session after 10 minutes. Chattering away while on mute. Well, welcome back. I hope you had, use that time to introduce yourselves, but also share your thoughts around your improvement work and what you would like to bring to this space and work with others on. Brilliant. Without further ado, let's proceed along. Now that you're back, can I just direct your attention to our text chat? And if you could please share your responses to that last question. What was it that you discussed with each other? Is there anything you'd like to work with others in this space, and be as specific as you like? So if you could use our text chat to please share that, that would be good, so that others are able to see what was discussed in the different groups. Okay, I've just taken a bit longer than I intended to type in the feedbacks from our group. So let's see, Livette, you're saying you're hearing how others, you want to hear how others are managing waiting time and access. Yes, we certainly had that in our group as well. Deirdre, you've shared, I'm working on some digital transformation, which is relatively new to me. So I'm hoping to make pathways paperless, also working on some pre-op assessment, pathway redesign and triaging. Fantastic. So again, examples of the work that you're doing and bringing here to share. Tara, you talk about how in your group, you talked a lot about how data could celebrate the workforce, the challenges around getting that, but recognizing that we need to tell the story. We had a similar discussion around how there's been we've observed really good use of data and how that's helped with us facing and moving through this pandemic. Owen, you talk about the challenges of being adaptive. That's definitely something that we heard in our group as well. Jonathan, you've talked about innovative approaches to problems of backlogs. So who's doing them? Where are they? Can we start to share and understand and learn from each other on that? Natalie, you've shared how in your group, you talked about using COVID learning to look at joint working and shared goals, to look at a system approach to managing backlogs. All of this really, really key to what we will be talking more about in this workshop, with that focus on the pressures of backlog and how improvement work can support the recovery of services. So with that, I'm going to move us to the agenda for today. This is what we will cover. Let me introduce Henry Can, a member of the Evaluation and Insights team at Q. Henry, alongside Joe Scott and Matt Hill, have been working on an insights project. Some of you might even have read Joe's blog post in August on their work titled Moving Past Backlogs, How Are Q Members Improving Access to Services? Henry will briefly introduce us to Sophie and Sigal for a conversation on their projects that are tackling the pressures of backlogs on service recovery. And by doing so, we'll kickstart a conversation in this workshop on how you might get support with the challenges or opportunities you are facing in your work. So over to you, Henry.
Thanks so much, Priya. So it's my pleasure to bring us into this next little session. And as Priya said, we're going to hear directly from two great projects which are working in their own ways on issues related to service recovery. And so just to situate that a bit, our current Insight project in Q is exploring the challenges for improvers amidst the current waiting times and backlogs which have been exacerbated by the pandemic, which I'm sure is an everyday reality for many of you. So we set out to identify common themes, approaches, and challenges that we could share as usable learning to many of our members. And so last month we put out a bit of a call for case studies, and we heard back a real range of approaches from a system level elective care hub to Health Connect coaching, which supports people to stay well while they wait for the treatment they need. And whether directly or indirectly, all of the case studies we shortlisted are projects which we think contribute towards addressing the backlogs in their own way. And so what's really interesting about the two examples we've got here today is that they both take an analytical and data-driven approach, which is something that you mentioned, several of you mentioned in the chat, to addressing challenges related to the backlogs, which we're hearing so much about. And so for the next 10 or so minutes, we'll be hearing directly from Sophie and Sigal as they discuss some of the differences and similarities in the work they've been doing. Meanwhile, please do chip in with any questions that you've got in the sidebar/chat. I'll try and keep an eye on them and hopefully get through a couple at the end. So with all that as context, let's go straight to Sophie and Sigal. And Sophie, perhaps you could just start by introducing yourself and your project.
Yeah, sure. So hello everyone, I'm Sophie Bulmer. I'm Network Development Lead at UCL Partners. For those of you who don't know who UCL Partners are, we're one of the 15 AHSNs working in England to help kind of support improvement activity in our region. We work in North Central, North East London, parts of Essex, parts of Hertfordshire and parts of Bedfordshire, so quite a big footprint. And what we've been doing since kind of summer, early summer, is working with North Central London ICS as their learning partner as they delivered their elective recovery programme. So NCL was appointed as one of the national accelerator systems for elective recovery, and this aims to deliver a more rapid trajectory for recovery to address backlog of patients and pilot new innovations to reduce health inequalities in accessing elective services. So for the first phase of the programme, the ICS set a really ambitious trajectory. They wanted to increase capacity to 110% of baseline delivery by the end of July, and they introduced 5 key interventions in order to help with this. The first was around moving to an extended hours working model, so evening and weekend lists, innovative staffing models, looking at best practice pathways and getting it right first time principles. The second was around outsourcing within the NCL NHS provider footprint, so establishing mutual aid and surgical hubs. So rather than people going to individual hospitals, grouping patients together and sending them all to a single site. They wanted to improve the utilisation of the independent sector capacity, so working with the private hospitals in their patch to deliver some of the routine operations. The fourth and fifth were really driven around data. So the fourth one is around enhancing system demand management capabilities. So this is looking at the analysis of referral rates, creation of a GP dashboard, detailed analysis of long waiters and demand smoothing, that sort of thing. And then the final one was the creation of a one system patient tracking list with advanced analytical capabilities. So this was about underpinning the access to NCL-wide information across the whole pathway, giving them detailed analysis and monitoring of potential inequalities. So, huge programme, short amount of time. Our role as learning partner was to really understand what was working well, what were the challenges, how was this working with the staff? And we did this through applying a learning health systems approach. So this is essentially combining agile learning and evaluation techniques to share learning for immediate action, as well as informing kind of medium-term transformation. And what we did was carrying out site visits, so going to visit the various hospitals, looking at the patient pathway, understanding that journey, talking to the people involved. We carried out semi-structured interviews with key members of staff across the system to kind of really get a deeper insight into what was working well, what were the challenges, what can we learn for the future. And we also kind of looked at the data, understood what was being collected within the system, trying to triangulate both the quantitative and qualitative findings. It's ongoing work. We're writing the report at the moment, so I can't go too much into the detail about what we've been finding, but what I can do, I think, is talk about some of the conversations we've been having and reflect on some of the key themes that have been coming out. So that's kind of a background of what we've been doing. Sigal, do you want to come up next and talk about what you've been doing?
Sure. So I am Sigal. I'm a principal analyst at Nottingham University Hospitals. And for the last few years, I've been embedded in a quality and improvement team. So the improvement transformation team of the trust. So this has allowed us to basically cover the QI projects throughout their entire lifetime, rather than only look at metrics or only look at dashboards or only look at individual data items. It allows us to actually cover all the QI under one umbrella. Another advantage, huge one for this, is that me as an analyst, I get to actually understand the system as a whole, because I'm working on a whole host of different projects. So the program I'm working on is improving inpatient stays. Under that come a lot of sub-programs, like improving discharge, improving same-day emergency care, all of which are aimed at basically improving flow through the hospital and releasing capacity, hospital capacity, that is beds, for patients. And so indirectly, it is, of course, about creating that capacity for recovery and reducing the backlogs, but through improving our processes around the inpatients that are in hospital, rather than directly the waiting lists. So the way we've gone about it is that we have a big program of work that is all, so each project is led by both an improvement lead and a clinical lead. They are working together. They come up with an understanding of what needs doing. That's all data supported. And then once we understand what needs happening, we come up with the objectives. Everything is measured and covered, and all the way to the impact analysis. And then we have a system of reporting out, so every project gets to tell of their achievements. Even if the improvement itself has been minimal, sometimes the impact on patient, like patient experience and staff morale, is actually really big. So they get to tell all of that. So it's really been a very good experience having the analytical support from within the QI team, rather than as something that sort of is added to it at the end to see if something happened. So Sophie, I wonder, so could you tell us a little bit about the challenges that you've got around what you do? Because it sounds like you're engaging with a whole lot of different stakeholders. And
yeah, it has been a huge number of stakeholders. I think some of one of the strongest messages that was coming through from us was around collaboration. So we saw examples of where this was working really well. And some of this was around those surgical hubs that I talked about that were established, but this was also one of the key challenges that was coming out in the conversations over and over. And this is around strengthening the trust and collaboration between organisations and across all specialties. So some of the surgical hubs, so I think like specialist cancer, they were working really well together, and they established really good ways of working. But some surgical hubs just didn't get up and running. And some of the conversations we were having, we were identifying kind of reluctance from organisations to ask for help. So we're seeing really challenged organisations with long waiting lists who would have benefited from this concept of mutual aid across the patch. But they weren't taking it up. And this was a real area of interest for us. And I think it's something that we'd kind of like to delve into a bit further. You know, what is it that stops an organisation from seeking help when it's offered, when it's openly available? Is it a cultural aspect? Is there something about a fear of showing weakness, that they don't want to appear weak to other organisations in the area? How do we change that? How do we change a message to show that if this help is available, you know, people should be encouraged to take it up? So that was one of the interesting things that we were noticing around the challenges. Another interesting thing was kind of around the data, and of course, you know, this new way of working was including an approach that's data-driven and that was informing the decision-making. And they worked hard to put this one system patient tracking list in across the system. And that included primary and secondary care. And it was really great at, you know, providing the capability to put in an equity analysis, share it across health and social care staff. But some of the staff are still struggling to access the appropriate data, and not everyone is kind of sure what they do with this data now they have it. So I think what we were seeing in the challenges in the system is there were all these things being implemented at pace, and by and large a real willingness from all the organisations to take part, but a lack of clarity and communication kind of at all levels, so that everyone understood what their part was in the system and how they could work together. Did you, Sigal, I wonder, have any kind of more experiences around the staff well-being and experience that you wanted to touch on?
Not so much staff well-being, but I think what you said about working across boundaries, that really resonated, especially when it comes to data, because some of the challenges we've got are from within the organization. So we've got this tension between operational performance versus QI, which does actually relate to staff morale a little bit. And because I think that when you come around and you say, we really want to help you improve your service, they always think, oh, you're going to just come up with new ways of measuring us and telling us what to do. And so I think that it really does resonate a little bit, that a lot of the QI stuff we do gets taken as instead of measurement for improvement, it's measurement for judgment, which is not very helpful. And that has definitely been a challenge. So it is. And the other, of course, is that people are so overworked and strapped for time, and QI always takes the last, it's like, how do you engage with people who are just so busy and overworked? And QI is always seen as the thing you could drop. You can't drop anything else, but that's the one ball that you can drop. So I guess it's how do you keep on the momentum of actually doing working on the improvement and doing it, because ultimately that is what's going to help relieve the pressure. But of course, right now it's more work. It's seen as being more work.
Yeah.
So
yeah, so, I think, yeah. Sorry, go on.
Go on. No.
No, I think that really resonates with some of the stuff we were hearing. So there was, as I say, there was a real willingness across all levels of staff to you know, this idea of kind of aligning around a common purpose, and that was really motivating for staff. But, you know, this was being introduced coming out of, you know, unprecedented demand. Staff exhaustion featured really heavily in all the conversations we were having. And where we saw real pinch points for staff was around admin and operational staff. So they were equally impacted by this increased activity for the accelerated recovery program, but there was no additional capacity kind of factored into the system to help out. So clinical staff had additional hours, or they had the utilisation of mutual aid or the independent sector. The operational staff managing the list, the admin staff making the appointments, absolutely no additional help to do this. So how do you think about, if you're going to increase the workload, how can you work differently? What models exist for administrative and operational support that can reduce the burden on this group? And that's one of the questions we're kind of really interested in exploring a bit further as well.
We've got some really good questions coming through in the chat, actually.
Great.
I just wondered, I think this first one is for you, Sigal, and Mark is wondering, how do you effectively monitor the capacity, encourage flow through the hospital, and what are the main constraints in the system?
So we're moving more towards looking at lead and cycle times instead of just counting counting patients in the different where they are. So I think it's an emerging sort of understanding that you can't just count how many patients you've got. It doesn't actually tell you what the demand is and what the pressures are. You have to look at how long things take and where the pinch points or delays are in the system. One of the ways is by making data more accessible. So in the trust, we've got, we use ClickSense, but I'm not here to advertise it at all, but just to highlight the advantage it gives in being able to bring together information from a whole host of different systems in the hospital. So whereas before everything was a little silo, you could see data about this or data about that, but each one was a separate system and had a separate analyst that knew about it. Now you can actually have access to a lot of information that you can get from the different systems to try and build a better picture of what's happening in the hospital. So where not just how many patients, but how long do they wait? What are they waiting for? Where are the biggest delays? That sort of information. So I think analytically, we've made huge advances during the pandemic, especially because we had to bring all this information together, and we had to do it really quickly. So I think everybody benefited from that. I hope that answered your question.
I can't comment on that, but thank you. ClickSense is actually brilliant if you've got the skills to use it. And when I think I was just on mute there, wasn't I? I'm just going to go, Sophie, there's a question for you, actually. Mm-hmm. What conclusion did you come to regarding organizations in...
Oh, has everyone lost?
Yeah, I'll jump in. I think we've lost Henry for a bit, and let me just turn on my video as well. Apologies. I'll read that question out, Sophie, to you. So it's from Caroline, and it's, what conclusion did you come to regarding organizations in need of support, but who are unwilling to accept it?
Well, I don't think we've come to any conclusions yet. So as I say, we're still kind of, we're in the process. This is just kind of a really interesting thing that we've uncovered through our interviews, and we are hoping to continue to support NCL as they move into the next phase of this work, and I think it's going to be one of the things that we'll be interested in digging a little more around. My suspicion is that it is, as I mentioned, there's this reluctance to appear, when you've got some organizations that are badged as high performing and all these other things, there may be other organizations within the same region that just don't want to hold themselves up as not as high performing. And I think the element of competition within the NHS has bred a reluctance to share and be open, and I think that that's something we have to kind of face, and that's why there's not as much collaboration between organisations, and it's something we need to overcome. But those are just kind of my personal reflections. It would be something we'd need to dig into a bit more, but that's my feeling.
Thanks, Sophie. I've got a question actually that could be for either of you, and it's from Clifford. How do we support organisations to share data openly and transparently and not work in silos? I know you mentioned ClickSense, Sigal, and that's obviously, I think it's got an open data element to it, but perhaps either of you could take that one actually.
Sigal, do you want to? Or I mean, I'm happy to. I mean, that kind of follows on from what I was just saying. I think there's a huge culture piece that needs to be done around giving organisations, embedding trust and making people feel open, feel that they are able to share information openly. I think it's a significant piece of work. I think there's a huge amount that can be done, but at the moment, without people feeling safe to do that, it's a real challenge.
Yeah, I think from my point of view, there is a lot of that uncertainty is around, and maybe timidness about engaging in QI is around lack of understanding of data. So people think, oh, I should know this, I should understand this. And the answer is, well, no, you shouldn't. You should learn how to engage with information and gain insight. The thing is, analysts on their own, so data by itself isn't enough. The numbers are not enough. You need the insight from everyone else. And for that, you need to somehow create a community that is engaged around data and doing more data-driven work. And for that, you need to get over this reluctance to ask for help, or to say, oh, I don't understand this. Could you explain this? Or could you teach me how to do this? And so different realm, but I think very similar at the bottom of it, very similar problems. Yeah.
Thanks, Sigal. With that, I think we're probably at time actually. I think I'm gonna actually have to hand over now to Jonathan. But thank you so much, Sophie and Sigal. That was a really, really interesting conversation. And I wonder if there are any spare questions going around in the chat. If you have time, it'd be lovely if you could cast your eye on them. But otherwise, thank you so much. That was wonderful. Yeah,
I definitely saw a couple of questions in the text chat. So it'd be great if we could answer them there. All right, well, thank you. And let me just hand it right over to Jonathan.
Thanks, Priya. Interesting discussion there. And I know today we're coming together around that issue of backlogs and weights, but there was a lot of principles that were discussed there that were just good principles for quality improvement and quality in general. So a lot to take away. So we're going to do some Troika consulting today, guys. And Priya, if you can move on to the next slide, thanks. Some of you may be familiar with Troika consulting and know of it as a liberating structure. So if you are, the next few minutes might be a bit of repetition, but if you haven't come across it before, it is one of liberating structures. The link that you see on this slide there is in the chat if you want to go and find out more. These are basically tools and different ways to get engagement levels within your group up and allow everyone to have a voice, and that's what we're going to do today. So we're going to embark on 3 quick rounds of kind of round robin consultation style, where we're going to have different roles within the groups. And you're going to share that topic or issue that we're all concerned about today, which is that issue of backlogs and waiting times, and perhaps the specific issue that's within your context. And we're going to share that with a couple of other colleagues, and we're going to get some peer-to-peer coaching moving along. Priya, could you move to the next slide? Okay, so this is the question or the issue that we want you to consider when you go into breakouts in a couple of minutes. Is what challenge are you facing, particularly around backlogs and long waits? And this is some of the pre-work you've been asked to do, as Priya had mentioned before, and also maybe ties into some of the sketch note sessions. It was a recent weekly challenge around the sketch notes, backlogs and waiting times in particular. If you move on, Priya. So if you have that issue or that question in mind that you want to get some help with, what exactly will Troika Consultant allow you to do? So there's 3 different roles within the groups, and it's normally groups of 3, but because of numbers today, you might find yourself in a group of 4. That's entirely okay. One of you is going to assume the role of a client and share that problem or that issue you have around backlogs and waiting times. And the remainder of the folk in the call are going to be the consultants. They're going to listen to you. And as you see, just starting up there in the top right-hand corner, the client shares that problem or issue they have. The consultants then ask some clarifying questions to understand a wee bit more around what they've heard. Since we're doing this in Zoom and not face-to-face in a room, we're going to have the client turn off their camera rather than turn their back. And the 2 consultants then engage in some discussion about what the client has shared and offer up perhaps some coaching advice, some ideas, some suggestions or solutions. And the client at the end of that is going to turn their camera back on and reflect on what they've heard and what they're going to take away. We had planned to do this for 10 minutes a round, so each of you getting 10 minutes to do this. We're a little behind time, so I think we're going to have about 27 minutes for the breakouts. So if you're in a group of 3, you only have to shave 1 minute off your round. So that's probably just having that conversation for 5 minutes instead of 6. If you find yourself in a group of 4, you're going to have to shave about another 3 or 4 minutes off that. So we can just be flexible about that as we go around the groups. If you can move on, Priya. Okay, so you'll see there are some text instructions similar to the graphic there that I just shared in the breakout. So if you want to maybe copy and paste that, you can take that with you into the breakouts just to keep yourself right. And if there is anyone who has engaged in Troika Consultant before, please help your colleagues out. But this is the issue. These are the questions that we want you to consider and present when you're in that client role. And as Sharon now moves us into the breakouts, just take a moment to reflect on what it is you want to seek some help with today. So welcome back into the main room. I'm sure that was very useful for you. And are we all back in? Okay, so want to get some feedback and if there's anyone brave enough to perhaps put their hand up and maybe share what that Troika Consultant session perhaps allowed them to identify and what was helpful about it for taking away from today. Mark Wilson, I see you have your hand up there on my screen.
Yes, hi Jonathan. Yeah, I just wanted to share, I think it really does work, and it's good to see with the Q community we can support and help each other. And it was good to talk and go through the process of Troika, which I have learned before, but I haven't used as much as I should have done. And yeah, I think it was a really energizing session. I think we were able to kind of offer each other some kind of solutions to the problem and then discuss them at the end to say, you know, like I've offered for process mapping to help out, to look at a whole process to see how I can support that. So I've offered my details across for that. And also as the lead for Q in Wales, my thing is that I really want to re-energize and reinvigorate the network in Wales. So we've been discussing on how we can actually look at that. And like I said, not just get additional numbers for the sake of numbers, but effective members, you know. So I thought it was a really good discussion. I really enjoyed it.
Thanks for that, Mark. Thanks for sharing. And Priya, I wonder if you could move on to the next slide, because we're going to get some feedback from everyone, and we're going to use a little favourite tool of mine called Chatterfall. So you'll see on the top of the slide there a question, just as I posed, that Mark answered. What has Troika Consultant identified for you, and how will this help you? what we want you to do is type your answer to that question in the chat, but don't hit send, don't press return just yet. And while you're typing it in the chat, I'm going to let you know what we're going to do. We're going to count down 3, 2, 1. And when we do that, we're all going to hit send at the same time. And you will have the equivalent of a waterfall or a chatterfall happening in the chat. So I'm going to give you a few wee more minutes to get your answer in the chat box. And I don't think I mentioned it earlier in my little setup for that session, but if anyone is interested, of course, there's the link to Liberating Structures in the chat, but the Q community also has a special interest group around liberating structures that meets each month. And just as Mark was saying there, we perhaps know about these things, but we don't try them out as often as we should. That's a safe space to try out these different liberating structures with a community of like-minded folk. So please look out for that. Okay, so I'm hoping that everybody's typed their answer in the chat box. I'm going to count down and then we're going to all hit return or send at the same time. So 3, 2, 1, hit return. And it worked perfectly. There we go. Thank you for sharing. Yeah, some things. Oh, it was brilliant. Collaborative co-design of solutions, perfect. Supported safe space, exactly what we were aiming for. Yeah, so thank you very much for that, guys. And I hope you get something out of that. And I think we're going to be repeating this in future workshops, so that space will come back. And without further ado, I'll hand you back to Priya.
Sorry, took me longer to unmute. Thank you so much, Jonathan, and everyone. I love the chatterfall. Okay, so this brings us close to the end of our workshop. Before we get into next steps, may I request all of you to take our evaluation poll. You'll see that come up in your screens right about now. There it is. There are 3 questions. Please go ahead and respond to the 3 questions. And when you're done, if you could then turn your attention back to the text chat and support us with an after action review exercise. So please tell us what works well for you and what would make these workshops even better. So start your comments with www, what worked well today, and even better if, EBI, whatever it is. We're very keen to hear your feedback, your thoughts of how this workshop is working for you. This is our 2nd workshop in the Community Space series. We want to ensure that we're improving and tweaking this along to meet your needs, and doing so with you. Okay, I see that some of you have started to do our after action review. Thank you very much for that. I'll give you another minute or so. Okay, so with that, let's move to next steps. So first up, I want to thank Sophie, Sigal, Henry, and Jonathan, and all of you for bringing your experiences to this workshop and working through that and sharing what you're working on, especially, you know, specific to our topic around the pressures of backlog and service recovery. We would like to encourage you to carry your learning forward. So there are many folks in the Q community who are probably busy working on these very topics, facing similar challenges, and perhaps have come up with ways to address them. And each of you can play a part in reaching out and gathering those experiences, those ideas, and supporting those across our community of improvers. So please do consider thinking about who do you know in our community who wasn't able to make it here today. Consider folks in your local and regional improvement networks, and we're asking you to carry this conversation forward by reaching out to them and asking the same questions you answered in our breakout room, using the Troika consulting method in those conversations, and really gathering more information yourselves, but also reaching out and supporting them. By reaching out and back into your network, you will help yourselves and your community understand how improvement work is changing and adapting to support service recovery. So please get together with your fellow members, discover those common challenges, and then consider repeating the Troika consulting method that you've tried out today, and then bring your learning back to our next workshop to share with us. We do have a very robust and active group on Twitter. So if you are out there, please use Q Community Space to share that learning and what you're learning from this particular workshop. Our next workshop is on December 2nd. Between 11 and 12:30. So this is a bi-monthly community space session. Our next workshop is on December 2nd. Please save the date. We are working with Q members to come up with a robust session for you. I'm excited about it. We're going to shift the light a little bit to focus on recovery of staff. I think that's going to be really meaningful for all of us to come around. So with that, I hope you save the date, and thank you so much for your participation today. Have a lovely rest of your day.